course, we're going to talk about a subject that I'm sure a lot of you have encountered, especially if you have horses or have been around horses. And we also have with us a very special guest, and he is a professional farrier, Mr. Darren Owens, and I've been knowing Darren for several years now. He has agreed to come on and give us some of his comments, his insight as we talk about this particular condition that affects many horses across the U.S. and around the world itself. And as we get into the webinar this morning, we need to understand exactly the magnitude of this particular problem itself. In fact, in 2018, the American Horse Council estimated the horse population to be somewhere around 7.2, 7.5 million horses in the U.S. It was also estimated that approximately 15% of that population would be affected by this particular problem, laminitis. To put that into perspective, that means that 1 out of every 7 horses is going to be touched with the condition, or out of that total number, we're looking at over 1 million horses on an annual basis that's going to have a bout with laminitis or a continuous problem with laminitis itself. Let's spend just a few minutes talking about what laminitis is. And the one thing that we need to keep in mind is that this particular condition or problem is actually caused by another issue that the horse has experienced. And we're going to talk about some of these conditions that triggers this particular problem, laminitis. Of course, we know, number one, that it's going to affect the horse, specifically the foot of the horse, the hoof capsule. We know that it is a very painful condition in itself. And what we have that comes into play is the lamina is affected. We have swelling within the hoof capsule. And we'll talk about the lamina in a little more detail as we get into the program itself. Of course, laminitis can, and most of the horses that will suffer a bout of laminitis will be lame. If we don't jump on the problem quick enough, then it can be fatal. And then keep in mind too that once a horse has had a laminitic bout, it's going to be always subject to the same problem in the future if we don't do a good job at preventing the problem itself. And I'm going to ask our guest speaker, Darren, how does the horse owner know that they actually have a problem with laminitis?
When we think about our horses and we think about the symptoms that would be displayed, we know that laminitis causes discomfort and pain. That is one of the first symptoms that we're going to see in the horse is going to be the discomfort and/or pain. This will lead to the horse actually having a reluctance to move. So, for example, if your horse is obviously in the pasture and it's time for them to come up to the stable, or it's time for riding exercise, and this horse is a horse that normally is at the gate waiting and is not, that would be a clue right then that the horse, the change in the horse's behavior and the reluctance to do its normal movement, travel, come to the gate, walk to the stable, greet you when you go out, etc. As this progresses, you'll begin to see the horse redistribute the weight. The horse being truly an ungulate by definition, it only has 4 places to distribute that weight in the 4 limbs, standing on one particular finger, if you will, one bone. It will then begin to try to put the weight to the back. You'll start to see the classic triangulation of the horse, where the horse is putting weight to the hind legs and using the very strong muscles in the rear of the horse as essentially a hammock or sling to support the weight. Further examination, you'll then pick up evidence of a digital pulse in the lower limb. down around some will find it in the back of the actual pastern, and then others can find it down lower, almost to the actual hoof capsule itself, down in the back, as if you is taken on a human being. The evidence of that digital pulse building simply is a result of compartment syndrome, where we now are starting to have a buildup of discomfort and an inflammation in the lamellar beds of the hoof capsule, and certainly that's going to be associated with warmth and heat upon examination in the hoof capsule as well, sir.
Thank you, Darren. And as we mentioned earlier, we were talking about lamini, and the purpose or the function of the lamini itself. It's the attachment mechanism that's going to actually attach the hoof wall and the sole of the foot to the coffin bone itself. And during this laminitic process, the blood supply is being compromised, oxygen is being compromised to the lamini. And as this blood flow is being compromised, then this lamina is going to want to die and to give away. So that's essentially what's going on there. And you know, there's a couple of types of laminitis, and we'll ask Darren to come back on and to talk about this as well.
Yes, we think about this. We think about an acute laminitic event often may be the only time that this horse would have, and so this is why when you look at the screen, it's divided in acute and chronic. The acute, it would be when you see the horse presenting with the discomfort, that the symptomatic issues we talked about before, and they're going to come on the horse rather quickly, and they're going to be severe in nature, and you're going to see things presented as we talked about, the restructuring of the weight, how the horse is standing. As this progresses and the pain continues, we know that laminitis, obviously there's a significant amount of pain in the dorsal aspect or front portion of the hoof. And so you'll see horses starting to, again, redistribute by using their heels to walk on when they come to you. And they're also protecting the actual apex of their distal phalanx or coffin bone when they do that, because that front portion of the foot is very, very sore, and they'll walk on their heels. That's the most comfortable portion of the foot at that particular time. This certainly is going to can lead to short-term lameness, and hopefully we in any laminitic situation, we're going to get the veterinarian farrier team on. We'll discuss that as we go further into the webinar, and then we have our chronic laminitic, and these unfortunately are horses that may have a much deeper reason for being laminitic, and they're going to suffer laminitic upsets, if we'll call them, conditions throughout their lifetime. From that, you're going to see more advanced problems, and you're going to see the actual hoof capsule itself being showing signs of deformation, because there is some change in the bone inside extensula. You'll see the white line widening out, as you see illustrated on your screen, and you're going to see things that are going to be remnant of a horse that is suffering with chronic laminitis, because this condition continues to be difficult for the horse as he's going along.
And Darren, as I travel about and talk to horse owners at these different horse expos and horse fairs, a lot of times that horse owner will actually make the statement that their horse has foundered. How do we know that a horse is actually foundered?
Well, that's going to be determined by the treatment team. That's going to be determined by the equine practitioners, the veterinarian farriers alike. The farrier will certainly see evidence on the solar region of the foot, especially in the horse that is suffering for a period of time where the hoof capsule begins to change, and you'll see the stretching in the toe. You'll see in the front of the foot, you'll see the stretching of the lamina, etc. But truly how it's going to be defined, you'll see growth rings, etc., that we talked about, the exaggerated growth rings in the heel, where the front of the foot's not growing, dorsal wall's not growing properly. but truly it needs to be diagnosed by the help of a veterinarian, and that would be radiographs. The veterinarian would assist us in the treatment in the sense of shooting or taking radiographs of the horse to be able to actually look at the inside of the horse's foot to determine the alignment and the position of the coffin bone inside. And the founder term comes in when there's true diagnostic imaging that determines there's been a movement of the coffin bone. And that term founder originated from a nautical term and was named because of the essentially that coffin bone at this point, as it's going through this condition and state, is foundering with inside the capsule itself. A nautical term for ships foundering at sea in a bad storm. So as we see on our screen now, with top left picture, you can see when you look at the front of the coffin bone, you can see an alignment that appears to be parallel with the front of the actual dorsal wall, the front or dorsal wall of the hoof. You see nice sole depth there, measured, I believe it's 21 millimeters, and you see the things look relatively, what we would call relatively normal in that particular picture. And then if you look at the other two images, especially the one right below that, you'll see distortion. You'll see that the toe is now distorted outward. And one of the interesting things that this film brings us that we couldn't see any other way is if you look at the very tip of the coffin bone, you'll see where the lamina has been torn in the very front of the foot, and you see these gas pockets. And what that is an abscess tract that has migrated from the front of the horse's foot up through the lamina, under the sole, and to the actual tip of the coffin bone. Abscesses are common tornadoes within the hurricane or the laminitic storm, if you will, and you'll see those in the radiographs. Again, only detected by a radiograph to be able to see the true entirety of the abscess. And then on the right, that's a picture of a actual horse's foot that is suffering from has suffered from a chronic, lifelong laminitic events. And you can actually see where the toe is distorted, and you can see some remodeling in the coffin bone, where the coffin bone is beginning to remodel due to the stresses that's put upon it as the horse deals with this condition through a very long lifespan.
As we take a look at the effects of laminitis on the hoof itself, of course, this can involve only one foot, a couple of feet, or the horse can actually have a laminitic bout in all 4 feet at one particular time. Most of the time, the condition is going to be in the front feet, simply because the horse carries about 60% of its weight on the front feet itself. Of course, during this laminitic process, we have this disruption of blood flow to the laminae, which is the attachment mechanism. And this disruption of blood flow comes about because of the inflammation, the swelling that's within the capsule itself. And of course, the important thing to keep in mind as far as blood flow is that the blood is carrying oxygen, number one. It's also carrying the nutrients that the laminae needs to survive and to replenish. And if we don't deal with this in a timely fashion, then the laminae is going to die and become weakened. And worst case scenario is that the coffin bone can actually rotate or drop through the sole of the foot. And if that actually happens, or if we have rotation, of course, if the coffin bone actually rotates through the sole of the foot, a lot of times these horses are going to have to be euthanized. But if that doesn't happen, then, and if we do have movement of the coffin bone, then this is irreversible there. The damage has been done, and then we've got to live with that condition for the rest of the life of the horse itself. And let's talk about some causes. What causes this particular condition in the horse? And as we take a look at these here, there's many causes, and I'll also ask Darren for him to jump in at any point in time as well as he goes about his business, working on the horses that he has on his books, he comes across this particular problem quite often. But the one thing that's up at the top of the list is nutrition and diet. And one of the problems that we have that's going on in this country and other parts of the world is this obesity. We have about 50% of our horse population, number one, that's overweight. And this leads to other specific health issues within the horse, and those are listed under the metabolic conditions there. Metabolic syndrome, insulin resistance, Cushing's, and all of those are contributing factors to this laminitic process. Another contributing factor to laminitis is if the horse is receiving excessive amounts of carbohydrates. So we need to be mindful of what the horse is actually eating on a daily basis itself. And then we have a host of other health issues at the very bottom of this slide, and there are many. That involves colic, diarrhea, pneumonia, a bacterial infection, blood poisoning. If a mare doesn't pass the placenta after she has foaled, then that's a likely case of laminitis there. Excessive stress to the horse can be a cause, and we can actually have a parasite overload that would contribute to a laminitic bout as well. And then when we get to the mechanical side, I'll ask Darren to jump in right here and to give us some insight on this.
Yes, Mr. Barker, and in addition to the array of health and or metabolic issues that you've certainly discussed prior to this, the mechanical side, one of the things that they kind of go hand in hand, as you see listed, is concussion and the trauma to the lamina. Now, when we talk about concussion, quite often that's going to be displayed by a horse that's working on the tarmac or working on hard surfaces, road horses that are being potentially ridden or driven, where the foot actually, especially in the summertime, can develop a large amount of heat within inside of it, and essentially cause inflammation or discomfort in that area in the lamellar beds due to the concussion. The horse is a master of actually doing away with concussion in its feet. That is results from ground reaction forces as it travels across ground, grass, tarmac. However, it can be overcome, and essentially that lamina will become inflamed, and you will find yourself with a type of laminitis that could progress from simple inflammation of the lamina to something we've discussed earlier in the slides, where you actually have movement in the distal phalanx. Fractures, sometimes we'll see those in young horses, not so much leading to laminitis, but you'll see where maybe the mom steps on the foal and can fracture the coffin bone down low, or affected joints. Often may see those with a puncture with a foreign object such as a nail or something that actually goes into the horse deep enough to infect joints and what have you. The fractures are going to be something that would be from a pretty significant trauma that the horse may potentially succumb to in his daily work.
And as we take a look at the next slide here, we were talking about excessive carbohydrates. This is just a simple graph of what can happen if that horse is receiving excess carbs in the diet. Basically, we have an overload in the small intestine itself. This forces those carbs back into the hindgut really before they're really ready to enter at that point there. And what happens is that we have an imbalance, especially as far as the pH. This creates a toxic situation there, and then this is picked up by into the bloodstream itself, and then this is the starting point of a laminitic bout that was created from excessive carbs in the diet itself. Mismanagement due to overfeeding idle horses causes 70 to 80% of laminitic cases. So let's keep that in mind there. These horses that are very limited in exercise, in work, that tend to be overweight, then sometimes too much is not good for that horse.
This is a very interesting slide in the sense that we know that founder is the second leading cause of death in horses, and to me that slide is just absolutely something that we would need to take note to. And the reason that we need to take note to this is because this particular condition in horses is not anything that's new. This dates back between 1 to 3.5 million years. This is not something that is new to the horse. However, there has been extensive research that has gone on through our veterinarian and research community, especially there at Life Data Labs and Cherokee, Alabama, trying to figure out how we can help these horses. So I would just like that slide to kind of resonate with you as we move through this webinar. Some of the breeds, should you own any of these breeds, you're going to have higher risk. Those breeds are essentially draft horses, as you see listed, Morgan horses, of course, your small ponies, and then your miniature horses, as well as your miniature donkeys. And I like to think of this in a way that's been helpful in the sense that the horses that seem to have higher risk are horses that are really good at utilizing their foodstuffs. And what I mean by that is that they're often referred to as easy keepers. They're often referred to as horses that don't need a significant amount um, of feed, essentially. However, they can do their jobs very well. So when you think about those breeds, those are horses that again will function, have a very high MPG, if you will, if you refer to them as automobiles, where we'll call them MGBs, where miles per bale, and they can actually do a lot of work with a bale of hay. Where, for example, go a lot of miles, where some breeds, as we refer to them, cannot do that. So those are breeds to keep in mind if you happen to own some of those, to really keep a watchful eye out.
Of course, we know that it's much easier to prevent the problem to have to deal with the problem firsthand there. And one of the first things that is critical is what we're feeding the horse. And we need to make sure, number one, that the horse is receiving a balanced diet. We need to make sure that the horse is grazing what it safely can without overloading itself with carbs and sugars that are especially going to be found in cool season grasses. Another thing that we can do is we can add to that diet supplementation in the form of a hoof supplement, which has a specific purpose, and that it's going to benefit the entire horse, and especially the foot of the horse, and that it's going to improve the quality of the foot internally. And then we need to be mindful of the farrier work that's being done, keeping a balanced foot in a timely fashion as well. And we specifically get into the diet of the horse, we need to, number one, feed in accordance to what that horse is doing as far as its workload. Each horse is an individual in itself, and what's needed for one horse may not be needed for another horse as far as calories and energy in particular. The nutrients are going to remain the same, but the caloric needs will differ depending on workload itself. And we're going to adjust the body condition score of the horse by the amount of calories that we're providing that particular horse. We want to feed little, and we want to do that often if possible. There's some things that we want to avoid, and that would be cereal mixes. We want to avoid sugar that's derived especially from molasses. Another thing that we need to be mindful is when we're feeding the horse is the speed that the horse is actually eating. And a lot of these overweight horses, that tend to have metabolic problems are going to be quick eaters. They want to gobble down that food in a rather quick manner. Another thing that is very critical, especially in the spring of the year and also in late fall of the year, if those horses are on cool season grasses, is fructans or fructose or these sugars that's going to be found in these cool season grasses there. And so we need to be very mindful at the time of the day that we're actually letting those horses graze as well. If we're using shavings, we want to avoid those that would have black walnut in those, because that is very toxic to a horse in itself. If we change the diet of the horse, we need to do that on a gradual, slow basis. And every horse would benefit from a little exercise if at all possible, and the horse is actually physically able to do that. And as we talk about grasses, and in particular cool season grasses such as fescue, ryegrass, bluegrass, and we could even throw clover into that, we need to be very mindful of the time of the day, number one, that we're allowing those horses to graze, especially if they are subject to laminitis. And we found that very early morning to about mid-morning or midday is the best time to do that, simply because the level of the fructans in that grass is going to be the lowest at that point in time as well. Of course, anytime we have an over-fertilized forage, then we're going to have excessive forage for that horse to consume there. Another time frame that can cause a problem with cool season grasses is if that grass is severely stressed, either from a freeze or a frost or severe drought. And at that point in time, we're going to have higher levels of fructans that can create a problem to the horse itself. And anytime we're going to introduce a horse to a new forage for the first time, we need to limit that at the get-go. And another thing that, as far as the diet, would be the incorporation of a hoof supplement itself. And what this hoof supplement is going to do, it's going to improve the internal aspect of the foot, and it's going to help improve the lamina, the attachment mechanism of the capsule to the bone itself, and it also can help from progressing from just a laminitic stage to a severe founder. Of course, one of the products that Life Data Labs has been producing for almost 40 years is a product called Farrier's Formula. Its intended purpose, number one, is to promote hoof quality, but it's also going to improve all the dermal tissue in the horse itself. So it's going to improve skin, hair coat, hair condition, but most importantly, it's going to internally regrow the foot. And that's going to help us with a laminitic bout, if that's our case.
Yes, Mr. Barker, it is absolutely something that I highly recommend for any horse. However, a horse that is suffering from a laminitic condition, we need the proper nutrients. The key word being proper and balanced nutrients going into this horse to help me, myself, and the others working on this horse to grow good dermal tissue. As we look at those bullet points on this particular slide, for me, in summary, what that says is it's grows good dermal tissue. And again, you've emphasized that the wall, the sole, the frog, and the internal components of the foot as well. And we need that. I view double strength farrier's formula. For me, I view that as an assistant, an additional team member in the treatment team for a laminitic horse. It's one that works on from the inside of the horse and helps me as a farrier on the ground to give me a good strong foot and to help bring relief and comfort to the horse as well. And one of the things that I find so reassuring as a professional and thinking of nutrition is Farrier's formula is safe, and it's safe for horses with acute laminitis. It's safe with horses that have had history of laminitis, or obese horses, metabolic conditions, pregnant mares, foals, and growing horses. So for me, the list of being a safe hoof supplementation for the horse is actually very comforting.
So essentially, as we feed farriers formally, it's going to thicken the hoof wall, but it's also going to thicken another aspect of the foot itself. And I'll let you talk about that, Darren.
Absolutely. When we think about the sole, for those listening, we think about the same as the sole in your shoe. The sole is the orthotic support, a portion of the orthotic support, or the orthotic support, if you will, in the bottom of the horse's foot. It goes up underneath the coffin bone, grows from the actual solar surface of the coffin bone downward, and provides this horse comfort. And if we're talking about laminitis and or the potential movement of that coffin bone, you'll have some impingement there, and you want to ensure that that horse is getting good nutrition to the sole, and we want that sole to thicken as quickly as possible to give that horse comfort from the ground reaction forces it's going to be subjected to.
And as we take a look at the next slide here, of course, long-term feeding of farrier's formula is going to completely regrow the foot over a period of time. And of course, the important thing with a laminitic horse is it's going to strengthen the bond, the lamina that's going to secure that hoof wall and the sole of the foot to the coffin bone itself.
Sure. This particular slide here illustrates things that we're gonna do, if you will, as we go forward in the event. For example, these are not going to be, I would say, acute aspects that a farrier veterinarian team are working on. They do apply, and they're part of that. However, these are going to be things that we're going to do, as you've noticed here, for prevention. These are things that are going to be everyday housekeeping for your horses. And essentially, so when you think about that, our job as a farrier is going to be for stress reduction. As this horse begins to return to locomotion, we're going to ensure that locomotion and that way of going is as easy as possible for the horse. We know that the hoof capsule is a viscoelastic structure. We know that structure can be subjected to deformation. So we know that structure will begin to move and or have change should there have been a bit more of an extreme case with the movement of the coffin bone. So it's our job to keep that hoof capsule tidy and to keep that capsule in the position to where you have optimal locomotion for the horse. And essentially, when the horse is standing, we want to think about stance tension and make sure that stance tension is optimal for the horse that's suffering this condition. And as you see in the bottom, to obtain that, our work should be done every 4 to 6 weeks. Earlier, normally, the better. That way, the horse is not subjected to a significant amount of change.
And when does this start, Darren?
Well, we think about that. It essentially is gonna start, right from birth. When the horse is born, we're going to be faced essentially with good stewards of these wonderful creatures that we have in our lives, and from the time the horse comes into the world, if we know that this is the second leading cause of death in these animals, then it should be on our mind the minute that foal hits the ground. And that's going to be from the wonderful work that Life Data is doing with nutrition and providing information to horse owners throughout the equine community, our veterinarians and those that are equine health providers that are giving us this information. And we know early intervention is something that was an effective tool should we be subjected to that. So we want to do, in my mind, we want to be looking at that horse the minute that that beautiful foal hits the ground.
And as let's go to the next section of our webinar, and that deals with treatment. What can we do? I would suggest, number one, that it's going to take a team effort And that team is going to be made up of the veterinarian, it's going to be made up of the farrier, and the horse owner plays a big role in treating a laminitic horse. Of course, the farrier will come in and do his or her thing. The vet's going to do that. And then the horse owner is going to be left there on a daily basis to manage, to take care, to keep this horse as comfortable as possible during this bout of laminitis. On the onset of laminitis, then we want to consult with a veterinarian at that point in time. Of course, something simple that the horse owner can do in the meantime is we can keep the feet cool. That is either with cool water, we can ice at that point in time. And if we have an acute case, we certainly need to treat that as an emergency because we want to jump on that as quickly as possible. We need to determine what caused the problem, and if we can do that, we will remove that problem so that it will help stop the progressive damage that's being done and help prevent future problems with this condition itself.
It is absolutely critical that you have a team of veterinarian and farrier and care providers that are associated with this horse that work seamlessly together. We'll go over individually their roles to include the horse owner's role as well. However, it's very important. This particular condition changes hour by hour, and it's very important that the team is able to communicate. And that team again is the horse owner, the veterinarian, the farrier, the grooms, anyone that's associated with this horse during this acute time frame, especially. So the veterinarian, obviously, we know from what was spoken in the previous slide, this is in a true emergency. Acute cases are a true equine emergency, and that would certainly be defined by your veterinarian and your farrier as well. And what the veterinarian is going to do, the veterinarian's role is going to work to reduce the swelling that is occurring inside the horse. They'll also be responsible working together with the farrier to take radiographs to look inside to see what type of progression they're looking at. For example, you might shoot radiographs on day 1, and then you're going to reshoot them on week 2, if you will, or week 1, and you'll actually could potentially see changes there. So they're going to give us a diagnostic insight into what's inside the hoof capsule and help us there. Again, they're going to be responsible for prescribing any kind of medication in the hopes that we could reduce the potential swelling inside the hoof capsule that's causing this horse significant damage. When we think about that, it's very, it can be described as a hoof vault. It's a closed vault, if you will, that the pressure cannot get out. That's why you feel those bounding digital pulses because of the compartment syndrome. And we know that when pressure necrosis begins, we're going to have oxygen starvation and the lack of nutrients destroy the tissue between the hoof wall and the coffin bone. And the veterinarian will be involved in working with the owner to help them with medication, and they'll have the lead role in developing a plan to work forward with this horse. And one of the things you spoke about, the icing, would certainly be part of the treatment plan that would go forward. And then the veterinarian and farrier would then devise some sort of modality of shoeing from then. And
And
quite
is
often, yes, sir, and quite often what you'll see, the farrier's role will be the mechanic. And the farrier, when the farrier goes forward with that, the veterinarian farrier will look at the radiographs and they'll decide which type of modality of shoeing and or maintenance would be best for the horse. Those can range anything from maintaining the horse in a barefoot state and using some sort of boot for protection. It can be a application of, for example, a heart bar shoe that would give the horse support in the rear aspect of the foot to help with support the frog. But what we're really concerned with is making sure that we can very quickly get recirculation back into the hoof and the hoof caps will help the hoof in that regard. There's some very large arterial supplies in there, one being the terminal arch artery, another one being the circumflex artery, and then a huge venous plexus that's under the solar region of the foot. So there's a lot of vascular supply that needs to be looked after. We as farriers are going to be very conscientious not to put any, should we nail the shoe on, we're going to work to the back of the foot and not put nails to the front. If the horse is in some extreme pain, we'll look for modern materials, i.e. our glues and sort of some sort of gluing modality of shoes to help us there. There's several different types that are available for tools for the farrier and veterinarian. So that's what the farrier, again, is going to be the mechanic and work to help the horse in that regard. The horse owner's role, obviously, quite often the biggest, in the sense that they're going to be responsible for this horse on a daily basis. And we talked about soaking the feet. If we think back, obviously, this is something that the horses would do themselves if they were left to their own. You'll see and read about horses that go stand in creeks or rivers, and often referred to as having hot feet. So the soaking, something you can do to enhance that is you can mix ice cream salt in, and that will help you as well, help make the water a bit cooler. And as we go also with the shavings, we're going to ensure that the stalls are bedded properly, and certainly nutritional support that would work, also be something you would consult with your veterinarian about, adjusting the horse's diet. Most likely would remove all of his or her grain, continue to offer free choice water, and make sure that you limit your hay consumption to a hay that the veterinarian feels is okay for the horse to eat.
And as we take a look at this particular slide here, if we have a horse that has a problem with laminitis, it's laminitic, then we have found here that most equine diets are deficient of certain nutrients that horse needs for the recovery to get beyond this problem and this condition. And the way that we have come to this conclusion is that Life Data Labs has always been a research-minded company. And we actually have an in-house lab that's in operation as we speak. And Dr. Frank Gravely and Dr. Scott Gravely have taken the initiative through blood testing to determine, number one, as far as nutritional needs. And one of the groups of problematic horses that they worked with was the laminitic, the foundered horse here. And through this blood work, they determined that there were certain nutrients as far as minerals that were deficient. There were certain nutrients that were toxic, more than what the horse needed itself. And so this gives us a true picture of what the horse is doing nutritionally, and especially during this laminitic bout itself. And as we talk about these different nutrients that horse needs during this stage and to help regrow the foot internally, then some of these that we will quickly mention is lecithin, tyrosine, and iodine. And all of these are going to support the liver of the horse. The amino acids are extremely important in rebuilding the hoof itself. Also, the essential fatty acids come into play to help build cell membranes, to help build the wall. Of course, we also have vitamin A and biotin, and then some of the minerals that we need to take a look at are calcium, copper, and zinc as well. And of course, that leads us to the product that we've already mentioned, which is Farrier's formula. And Farrier's formula contains a lot of these nutrients that horse needs to regrow the foot, to promote hoof growth, to help combat against a laminitic process there. Farrier's formula is a very safe supplement to feed to pregnant mares, to foals as soon as they get big enough to start eating and nibbling a little bit. And we've actually, through this blood work that Life Data Labs has done, and on this particular group of laminitic horses, we found that there has been excesses and then there's deficiencies of certain nutrients that that horse needs to fully recover. And one of those things is zinc. And this group of laminitic horses that have been tested, they show low levels of zinc within the blood itself. We have excesses of magnesium, phosphorus, and selenium as well in this group of horses, and some other critical nutrients, copper, vitamin C, and some of these we've already mentioned as well, thiamine, D-L-methionine, yucca extract, and then your amino acids. And what this research has led to is the creation of a new supplement, which is our Lamini formula. And this is a companion product that's to be fed in conjunction with farrier's formula. And what these two products are going to do together is they're going to meet all the nutritional needs of the laminitic horse and the foundered horse. Of course, the purpose of the Lamini formula, along with farrier's formula, is to help reduce inflammation. It's going to help maintain blood flow to the hoof capsule itself. It's going to help alleviate future bouts of laminitis, to reduce the incidence of laminitis, particularly if we have a horse that has a chronic problem. Let me reiterate once again, this is a companion product to be fed with farrier's formula. Now let's keep in mind that these two supplements cannot do what we see on the screen here. They cannot control excess carbs that's been given to the horse. These supplements cannot control overconsumption of concentrates or feedstuffs or grain, and these supplements will not control any type of a mechanical problem as far as laminitis itself.